Hi. Hi guys, my name's Julia DeJong, and the policy that I'm advocating for is making dental care more accessible in the United States. So, first, I want you to imagine that you did not have access to this routine dental care, and then one day you notice you had some tooth pain, but you brush it off as going to the dentist isn't really a it's not a very smart option for you. And months are passing, the pain is still there, and it's just getting worse, but still, you're not able to go to the dentist. So you're just trying to ignore it. But unbeknownst to you, this pain has now become a horrible infection and is now starting to spread to the rest of your body. And one day, your body actually goes into sepsis due to how severe and bad the infection is in your mouth. And this is an unfortunate reality that happens every day in the United States due to lack of accessible dental care. And this is just one example of how it affects lives in the United States. But so I'm a biology major on the pre-dental track. So this is an issue I feel very passionate about, as dental and oral care is just as important as any other sort of medical care or medical services. And I don't think a lot of people realize how connected dental hygiene and then just general health is, and how severe the impact can be. So I want to change this policy in order for all Americans to receive the health services that they need. And I believe that the policy change agent who could adopt my policy is the Centers for Medicare and Medicaid, also known as the CMS, because they are kind of the organization that can go in and edit and add policies to Medicare and Medicaid. So, first, I kind of want to just give an overview of what Medicare and Medicaid covers right now. But so as of right now, comprehensive dental care is not included in Medicare or Medicaid in the United States. And that's unless you need to be approved for extenuating circumstances, but it's very limited. So, according to KFF, in an article titled Coverage of Dental Services in Traditional Medicare by Meredith Freed, Trisha Newman, and Juliet Kabansky, traditional Medicare does not generally cover preventative services such as just your normal checkup, exams, and x rays, or even the more extensive services such as root canals, wisdom teeth removal, and dentures. But these services are necessary to make sure individuals are living a healthy life. And to add, half of Medicare beneficiaries did not have a single dental visit in the last year. And one of the main reasons that people couldn't go was cost. So that was like a main barrier for those who couldn't get dental care. And then among those who could go to the dentist or use dental services, the average out of pocket cost was $874, which is a lot to ask for someone who's already living kind of like a low income lifestyle. And then also, dental care is broken up into four different levels of coverage. So that's no coverage, limited, emergency only, and then extensive. So, according to Center for Healthcare Strategies in an article titled Medicaid Adult Dental Benefits, an Overview by CMS, no coverage means that they will not pay for any sort of dental care for you. And then emergency only is relief or pain that's defined under one of the emergency situations, which could be like, say you fell and you like knocked out all your teeth, that would be an emergency situation. So then they'd cover that for you. Limited is more just like your general services, but it is capped at $1,000. And then extensive is more a comprehensive mix of dental services, such as I think it's over 100 diagnostics of preventative and minor and major restorative services. But again, it's still capped at $1,000. And then only 19 states will, including DC, cover extensive services, which means 64%, which is well over half of the United States, does not offer these crucial services. And furthermore, 44% of low income adults aged 20 to 64 have untreated tooth decay. And I think around 5% of these low income adults have lost all their teeth. And I know 5% isn't like a huge number, but when you think of how many people are in the United States, it's a really big amount of people. And then also, adults who are disabled or homebound or institutionalized are at an even greater risk for dental disease. And then I want to go more into like the science behind it. So, as I stated before, I'm a pre-dental student, and so I have all this knowledge on how oral health connects to overall health. So, I feel like it's my job to explain how dental hygiene connects to the rest of the body. So, scientific research has proven that health starts from the mouth. And according to a study published on MDPI titled Oral Health: The First Step to Wellbeing by Lucas Fioroli, oral health has potentially multi-organ systematic implications. And as a result of his findings, it could be from just insulin resistance. So it could cause like health issues such as diabetes due to periodontal disease, or even affecting the cardiovascular system or the neurodegenerative system, which is your heart and your brain. And that could just have a crazy impact on someone's life just from dental hygiene. And that's why, and just like the connection between oral and like dental hygiene and then overall health, like there, it's just been proven so much by science. And that's why I think it's just honestly disturbing that dental care isn't under Medicare or Medicaid and not accessible. And considering the economic difficulties can impact like can negatively affect the quality of oral health and then in turn general health. It's something that I think needs to be changed. And then to add, I also found in MDPI in a study titled Dental Outcomes After Medicaid Insurance Coverage Expansion under the Affordable Care Act by Hazawin Alani, Ichiro Kawachi, and Benjamin Summers. This study found that there was a positive association between expansion of dental care under Medicaid and Medicare and overall like oral health and overall general health in low income adults. So what this means is like it was statistically significant that when compared to people that like did not have dental care. So they did this study where they would expand dental care in some areas, and they were able to see a general increase in health between these low income adults. So this even more supports my argument on expanding dental and oral care. But now I kind of want to go back to what I was saying at the beginning. So now instead of not having access to dental care, imagine now you do have access to affordable dental care. And instead of putting off the pain in your mouth, you are just able to schedule a quick appointment with your dentist. You go in, it takes maybe 30 minutes. They fill the cavity that you had, and then you just walk out. But you don't realize that you actually just prevented yourself from having a horrible infection that could have been fatal. And that would be the new reality if my policy was adopted by the CMS. And I think the impact this policy could have on so many lives in the United States is like astronomical. But thank you. If anyone has questions.
I have a question.
Yes.
Uh, on the CMS, if your policy was implemented in the CMS, basically like two questions. Can you elaborate on the CMS? I might have missed that. And two, if it was implemented in the CMS, would it have to go through any barriers, like legally or federally, like have to pass through like any like legislation before it
Mhm.
actually be implemented? Because obviously it would have to deal with like insurance and stuff, but I don't know if that's what the CMS like covers. Because
So,
I understand.
yeah, CMS is like the Centers for Medicaid and Medicare, like they're like all the services. So, I just would be I would be addressing them mostly because they are the ones that can go in and add policies. But yes, it would have to be it would because Medicare and Medicaid I think is state to state, so it would have to go through state legislators.
Definitely, definitely.
Thank you.
So I know you talked about how like, maybe a lot of people don't understand like how important their oral care is. And like I feel like for me, this is like a topic that I've never really heard of. And maybe that's from the area I'm from, or just it's not commonly known of. But do you think that like the lack of knowledge from just individuals also contributes to like the fact that this isn't like a pressing matter at this point?
Definitely. So I grew up like my mom is a doctor, so she was always like just showing me like things. So I feel like I always had more knowledge than like some like the general population on this stuff. So I definitely think that like I think a lack of knowledge for any topic could be like something that allows for oppression and like stuff like that. So definitely.
I just had a quick question. Do you think oral care and medical care should be like together or just more accessible? Like, do you think they should be one and one or just like more overall more accessible?
I think that's a good question. I think it shouldn't be grouped in with just like other medical stuff because there's so like the reason it's separate is because there are so many different like fields and differences in medical like services. So this is just one that is kind of like separate and like very or it's not like very generalized, it's really specific. So we wouldn't, I don't think it should be like grouped. It should still say separate, but I think it should be more accessible just because of how like specific the topic is.
Um, I had a quick question. I'm pretty ignorant when it comes to this topic. You talked a little bit how oral health could be related to your body's health. Can you dive a little more into that and maybe talk about any other potential benefits that it has to your overall body's health?
Yeah, so one that's really common is the infection can cause like if you have an infection in your mouth, like it can spread pretty quickly. And just like I know, well, one of the big ones I hit on was how it can like a lot of dental and like oral hygiene can affect like diabetes is one of the main ones. And then even like your heart, like I think it can go through like your bloodstream and stuff and it just connects to like the rest of your body. And so just like having this oral like health like starting with like your mouth and stuff like what I was saying how it's like backed up by like science and stuff is just like the beginning to every like other part of your body.
Is there anything we could do to kind of push for this change or?
I think, well, the only thing that you could really do is email either the CMS or state legislators and just try to like trying to push this policy or even just your state, yeah, your state like governor or something like that, because it is a state to state issue.
So I'm going to kind of bounce off of what James said. Like, there's a lot of people that don't realize that dental and vision are not part of your normal
Mhm.
like health insurance because it sounds like it should be part of your health
Yeah,
insurance. So, I mean, I've seen over and over where people are like, "Oh yeah, I have dental," and they give like their regular health insurance, and they're like, "No, no, 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 no. It's you have to buy separate." So, do you think that we educate people enough on the importance of health insurance and, or I mean, sorry, dental insurance? Because, like I said, we don't even, some people don't know.
yeah, I don't think people are educated enough on how, I think people really do think it is part of their insurance, but then when they go and they go to the dentist, they get billed a humongous bill and they're like, whoa, like I thought my insurance covered this. And they're like, oh, no, that's not part of it. So I definitely think we're undereducated on that part. And it's almost on purpose, like they're trying to hide it. So they think that you have it covered, but you don't.
No, and I don't feel personally like dental insurance does a good job like really covering patients. My
Yeah.
son had a tumor
Hmm.
in his gums. So obviously that was a
Yeah.
dental
Yeah.
situation. And insurance was like, yep, we'll pay for the surgery, but
But
you have
not,
to pay out of pocket for
yeah.
anesthesia because that's not typical
Yeah.
dental anesthesia.
Exactly. And like I was saying, like they a lot of times they cap it off at $1,000. So if you have a procedure that is over $1,000, then you're still getting that money off, but it's still not great.
And not
It's
all,
expensive.
yeah, and not all scans. Like one of his mandatory scans was $300 out of
Yeah.
pocket
Yeah.
because insurance is like,
No. Yeah, exactly.
so I think there's room for a lot of education just in general in the dental world.
Definitely. I agree. Any other
Well,
questions?
okay, I think you're good to stop.
Okay.